in recent years, we know that we've seen a huge surge in the demand for teeth whitening treatments. How many patients coming to Tracey Bell would you say now ask about teeth whitening?
I would say round about probably 90% of our dental clients, normally on their initial appointment, they will always ask about teeth whitening. Why? Because I think we see it in the press, we see the celebrity smile. And again, if you look at some of the recent surveys done by the General Dental Council and also the British Association of Cosmetic Dentistry, teeth whitening is certainly a commodity. I think 73% in the recent survey by the GDC of patients actually wanted, so it's a want.
In terms of the most popular treatments at Tracey Bell, which would you say would be your most popular teeth whitening treatments, and also which would be the ones that you would recommend most highly?
Again, teeth whitening, I think people get confused. They come in and they say, look, can I have my teeth whitened? There are many different ways that you can whiten teeth. One is by simply take-home trays. Secondly, you can do an in-surgery procedure. Sometimes they will call that laser. It is not laser whitening. That is a fallacy. It's simply a blue light that we used to use to activate or heat the gel. And the third type, which is the most popular at Tracey Bell, is a combination of both. And it's like anything I always say to the patient, you know, what result do you want, how much you've got to spend, and how much time have we got to do it. So again, it comes back to the autonomy of the patient and what the patient actually wants. And I think as a dentist, that's what we should provide. We should listen to the patient.
So if a patient came to Tracey Bell wanting brighter, whiter teeth, roughly what kind of price point would you be talking at? What would the prices start from?
Okay, well, when they would first come in, they would always have an initial examination that would allow us to assess the teeth, the health of the teeth, the health of the gums. Teeth whitening, typically, and again, not just at Tracey Bell, but in Great Britain, price would normally start around about £199. That's a reasonable price for teeth whitening. I can bring you all the way up to probably £1,000 if you wanted, depending on where the clinic is, the experience of the dentist, the commodity and the type of bleach that they're using, and again, the result that the patient wanted to achieve. But typically, anything between £200 to maybe £700, £800 is the average price of different types of teeth whitening in Great Britain.
Okay, obviously, for those kind of prices, we're talking about what you'd pay if you come into one of the Tracey Bell clinics, where you have 23 years experience as a dentist, really, really highly trained here, and an awful lot of dentistry awards under your belt. We know that there are other places that people can go if they're looking for a cheap fix. We hear about sort of salons, places offering illegal teeth whitening, and clearly you have been leading a campaign on this to crack down on illegal teeth whitening.
No, illegal teeth whitening. Again, the first thing that I think it's important that anybody needs to understand that is considering teeth whitening, it is completely illegal and unlawful for anybody other than a dentist or a dental care professional, i.e. a hygienist or a therapist, to whiten your teeth. We have seen, I would certainly say, being based in Liverpool in the last 6 or 7 years, we saw people, beauty salons, we saw hairdressers, we saw people that were completely unqualified that used to come in and they would say, I can do your teeth whitening. And again, they probably started many years ago offering it for £200. What then happened was the General Dental Council and obviously the dentists started to recognise that this reported action was happening more and more. And then the General Dental Council and the British Dental Association have brought in regulations. And again, if we look in February of 2015, the General Dental Council have prosecuted, I think, 4 or 5 people in the UK for the illegal practice of tooth whitening. So again, I would always say that you need to ask about their experience. You certainly, the first thing you have to ask is, are they a dentist? Yeah? Have you any experience? And again, people say, is this good or is it bad? The unfortunate thing is that people that are providing this service as well are often missold a product by a rep. So again, my thing is, not only should we go after the dentist, after the hairdressers, the beauticians, the man on the street, but also the people that are supplying, these people with the bleach, with the whitening, with these lights, because again, it's illegal. And trading standards and also the General Dental Council have and are there to protect the public, which I'm very happy to see.
So, for members of the public who perhaps haven't watched this video, haven't done their research and have just gone to the cheapest person offering teeth whitening, what would be the dangers or the downside for someone to have done that potentially?
I think first of all is the health and safety issues. I often hear that they went into somebody's living room. There was a bed taken out. They had bleach applied to their teeth. They had burns. They had no result whatsoever. But again, it's like anything. If you pay in very little for a service and there is a downside to that, do they often complain? No, simply they don't go back. So again, what I would say is that, you've got your health and safety issues, you've got the ultimate overall result, you've got your time, you've got your resources, And again, I often see people that have had teeth whitening or have had problems with ulceration and burns and again, no result, come to Tracey Bell and say, look, I need my teeth whitened, having spent over £100 somewhere else.
Would you say that that's something you're seeing more and more of, people that have had those bad experiences and they're then coming through the door here?
Yeah, because again, teeth whitening, a healthy smile and a white smile, I would say to any age is important, Again, in the UK, we probably have been brought up where teeth weren't the top of our priority. But I think again, we look at the media and we see people with the nice teeth, Not everything is veneers, not everything is crowns. Some of it is just healthy, nice, white teeth. And I think that it is very, very important that a nice smile, is in a way what you're judged by. So I see lots and lots of people of all ages. People say to me, well, what age can you whiten teeth from? And again, down to General Dental Council, we used to be 18 plus. We had a cut-off at 18. Now we have a little bit of laxity in that, in the fact that we can professionally, even at 16, 17, if it is right for the patient and we are doing no harm, we can whiten teeth. And again, speaking as a mum, we have 6 kids. I've got 4 that are teenagers, and they watch the TV and they come in and they say, Mum, I want my teeth whitened. And as a mum, would I whiten their teeth? Yeah, I would. You know what I mean? As long as I do no harm. So I think as a dentist, we're here to restore and maintain oral health. And I think that teeth whitening goes in par with that. The only thing that you have to understand is you have to understand that it should be done in a professional environment. And I think that if you get a nice dentist, dentists in the past would always, if I said to you, give me a stereotypical type of a dentist, you'd say 50, white coat, grey hair, and mask, and miserable. And I think that that's all changed. I think that as a dental professional, that the way that they teach us now in universities, etc., it's about communication, it's about listening to the patient. And it's certainly come round in the fact that it's a fantastic profession to have. And as a dentist, we're there to help individuals, and so no longer should you be frightened of the dentist. We're here to help, we're here to improve smiles.
Just returning to what you were saying about the ages of the people coming to you for teeth whitening, what would you say would be the youngest and the oldest patients coming to Tracey Bell for treatments like teeth whitening or for braces, which I suppose in the past we might have associated with younger patients?
Oh yeah, again, if I tell you about I've been qualified as a dentist for 22 years, 23 years now, so I'm giving my age away. And I've gone through the 90s where we didn't talk about cosmetic dentistry. Then we got into 2002, 2003, we had an increase in income. We certainly saw a commodity where, and again, was it ethically right or wrong, where people would turn up very young, older, having veneers and crowns and different things like that. So again, ethically quite destructive procedures. But remember, at that point, we didn't have a lot of different technologies. You know, at one point it was illegal for even dentists to whiten teeth, yeah, because of EU regulations. Now, I think that we've got a new surge of cosmetic patients. So we have the bleaching, we have the bonding, so i.e. rather than putting a veneer on, we would basically put white composite, yeah? We would align the teeth. So age-wise, anything from an 11-year-old walking through the door, wanting conventional braces. I think the oldest patient we have at Tracey Bell that has got an orthodontic appliance and that has had whitening, I think is Jerry, and he's 78, yeah? Absolutely ecstatic, yeah? Because 78, he wants to have straight white teeth, yeah? Now I'm not saying Simon Cowell, he just wants his own teeth better. And I think again, you know, the way that we deliver dentistry is different. You know, people say, are they still patients? Yeah, they're still patients. But you've got a consumerism, you've got an element of, they are consumers. They are able to shop round, they're able to walk into a place like this. They're able to get advice, yeah? But it's finding a good, ethical dentist that you trust. And I would always say to patients, if you're looking for a good dentist, you want to find somebody that, one, gives you the time. Secondly, they give you every option. So, you know, you don't want to go to a dentist where the only brace I do is Invisalign. The only whitening system I do is, I don't know, Zoom. Because then, you know, they're being very paternalistic in the treatments that they're delivering to you. And again, it's a patient's choice. So again, as a dentist, you've got to be educated. I spend hours every week reading up on new things because I'm passionate, I love my job. Yeah, I just wish that everybody was like that. It's the same in any career, yeah? So again, you know, you're looking for somebody that can communicate with you, give you time, give you all options, even if they don't provide it. Fourthly, they're quite happy to refer you to somewhere else if they don't provide those treatments. And then fifthly, they give you the time to think about it. Yeah? So I'm quite happy when they walk out the door and they've got a treatment plan. Give me a call anytime. And all our dentists at Tracey Bell, we have an operational system whereby they will come in, they will run through the treatment options, they will be given they will be given a treatment plan. They'll have photographs and let them go. Yeah? Because I know they're always going to come back.
I think this is one thing that does appear to set you apart from a lot of different dentists, that you always get the impression that you're very happy to give your patients access to as much relevant information as you possibly can. As you say, let them go away and do their own research. I've noticed that unlike a lot of other dentists, again, that you can go on your website, and if people want to do their own research, they can take a look at various different teeth whitening systems, even before they come through the door.
Yeah, and come back and ask the same questions. You're long gone are the white coats where the doctor knows best, or the dentist knows best. Yeah, I compete with Dr. Google. Yeah, I call them myself. They go on the internet. Yeah, I say, oh, come on, tell me what Dr. Google tells you. And then I say, right, okay, well, this is why. And again, I think, any profession, you build relationships and you build trust. You have a question, you ask. You don't sit there and accept always what the doctor or the dentist tells you. And again, you know, when you open up and you look at Google and you look at the internet, I think it's a good thing as well. You know, it educates. It keeps me on my toes because, you know, if I don't know it, they're certainly going to come through that door, yeah, and ask me the question that I should know. Did you understand it? It's really, really important that you're open, you're honest, and that you give an opinion that's fair.
So, for viewers who've already watched your video, who've already had their consultation with Dr. Google, would you say that the next logical step then would be coming into the clinic, even if it's just simply to get a consultation and get all of the information?
Yeah, you know, I think that any dentist, not just come to Tracey Bell, but if you've got a good professional dentist, you should be able to go in and ask questions. Listen, I'm a savvy consumer. Before I have anything done, even if I buy carpet, right, I'll do my research, I'll go in, I'll always want a fair price, but I'll always want it done properly as well. And I want to be able to shake their hand, do a deal, and get ready to do the next one.
Fantastic, thank you.
Yeah, thank you very much.